Good afternoon. Today is August 17th, and I am excited to share some information with anyone who's watching this about Healthy Rural California and our graduate medical education efforts, how we are structured, what it means, why it's different, why it's unique, and why that's important for the community. My name is Christy Bird McKeeve, and I'm the CEO and founder of Healthy Rural California, along with Butte-Glenn Medical Society. We went down all of this path in 2019 following the Camp Fire, which was next door to where we are. This is our office here in Chico, and Paradise is just up the hill. And that's where the Camp Fire was. And that's really top of mind at this moment because of what just happened in Lahaina and Maui. And it really reminds me of, Hawaii has terrible access to care issues as it is. And I know for a fact there was a Kaiser clinic in Lahaina that burned down. And so they're losing more healthcare, which is a very similar situation to what happened in November 2018 with the Camp Fire here. So again, I say this very clearly because there's a lot of folks who don't know the history of why we've been down this path. And so I just want to share it again. It was July of 2019, and we had an in-district meeting with Assemblyman Gallagher through Butte-Glenn Medical Society. And in that meeting, Gallagher recommended that we start a residency task force to really look into how we could establish graduate medical education in Butte County. And then we had our first task force meeting in August, and that was the time that we really had a lot of momentum around starting with a psychiatry residency first. And then second would be primary care, most likely family medicine. But our first and foremost effort was around psychiatry because of the Camp Fire. There had already been a decline in the number of psychiatrists in this area, particularly in Chico and Oroville and Butte County. And there had been growing concern. And then after the Camp Fire, all of the trauma and the mental health issues that followed were top of mind for everybody. Again, it's hard to go through what, Lahaina's experience because it is so similar to many of the folks in this area and what they went through in 2019 following that fire. So 2019, the Butte-Glenn Medical Society Board also agreed to establish Healthy Rural California as an affiliated but separate 501c3 nonprofit. And that was because most medical societies in the state of California, which we are affiliated with, and especially affiliated with California Medical Association, having a 501c3 would enable us to do more public health work, which is part of Butte-Glenn Medical Society's mission to really look at access to care issues in new and innovative ways, and to provide fiscal management for local coalitions. In 2020, though, we got IRS approval, and at the same time, we launched a feasibility study for the psychiatry residency with an eye on family medicine as well. We worked with amazing consultants, Kiki Nocella and Maggie Fassbender of Whip Flea, and they determined in their feasibility study that Healthy Rural California should be the nonprofit consortium model, that our community was still recovering from the Camp Fire, and that as a consortium model, we would have more local control. This was also because we had a great meeting with UC Davis in November of 2019, and it was proposed at the time by several people in the community that we do a 2x2 or a rural track where some medical school like UC Davis would have our residents for the first 2 years, and then they would come into our community for the second 2 years. However, the nonprofit consortium model was what ultimately the community agreed to. And it's also possible, like there are some county-based psychiatry residencies. I referenced the San Mateo County psychiatry residency. It's been in existence for 40 years. It's well established, and it's very helpful in them recruiting psychiatrists to work there and then with their hospital affiliates. And so, but our community said that the consortium model would be stronger and not have the sponsoring institution at the county. Sponsoring institution is an accreditation status by ACGME, and Healthy Rural California became accredited to be a sponsoring institution in the fall of 2021. And then that enabled us to build out specialty residency programs. And I will say this, I say this a lot, that traditionally you have a medical school and you have a hospital, and that has established those specialty residencies decades ago, or it's at the county because the county has all the resources plus a neighboring hospital that is providing, the mental health services that are required by ACGME for the psychiatry residency. We are unique in Butte County because we, especially in Chico, we don't have a medical school, and some of the local hospitals have not been able to enter into sponsoring institution status, nor have they been focused on medical education in any great way. Although that is changing now in 2023, and we're really excited. Back in 2021, when we really started to dive into the psychiatry residency, those weren't available. And we're thankful, right? Despite the pandemic and multiple more fires in the past few years, Healthy Rural California has continued on this path to become a sponsoring institution. And then we got accredited Healthy Rural California for psychiatry in February of 2023. So it is a different model, but it was chosen by our community for our community. And I stand by that, not just because I'm CEO and founder, but there's not enough of the psychiatrists in the community. At the time that we went down the path of accreditation, there were no child and adolescent psychiatrists. You need to have neurologists who teach the residents, and you have to have certain inpatient and outpatient experiences as a part of your curriculum. And so that is why year one of our psychiatry residency, with the first cohort starting in 2024, is in Sacramento. The VA of Northern California at Mather will be our, sort of first year clinical experience. And they are a fantastic partner because they have education in their mission. And they also have had residents. So our first residents coming into their curriculum, even though it's with Healthy Rural California, will be part of the graduate medical education established training at the VA in Mather. In addition, there will be rotations at UC Davis for specific rotations that could not be met in Chico at the time and still can't. One of them being neurology. And then we will have 1 month rotations at Northern Valley Indian Health in Woodland. Again, you need to have board certified physicians in the specialty that is required by ACGME, and Northern Valley Indian Health has a family medicine doctor who is board certified in Woodland. And so that completes the 12 months of the first year of that curriculum. Year two moves into Yuba City. We have had agreements with Sutter Yuba Behavioral Health, and then Ampla Health in Yuba City had a stronger behavioral health department. And we're looking forward to meeting with them in September because we understand now that they've really built up their Chico behavioral health services. And we're looking to get that updated in our curriculum. So year three is continuity clinics, and year four is electives, and more on that in the future. But I do also need to explain that we are on a timeline that is rather long. And it's so great to celebrate that we got accredited in February of 2023 for the psychiatry residency. And yet there's so many changes that will need to be documented in our business agreements, as well as our program letters of agreement, which is our agreement with GME and with our clinical partners, that this is the site director, this is the core faculty at each of the locations. The program letters of agreement are specific to GME. So in preparation of our first cohort of residents being selected through the National ERAS system, and then lots of interviews between October and September and January, basically, with the match for the first cohort of 4 in March 15th, 2024. We're on that track. So we need to update program letters of agreement in September and October. We need to have business agreements signed, and as well, we will be requesting some funding because psychiatry is going to be funded through teaching health center dollars, and they are on the lower end of what is possible. And then we, as Healthy Rural California, the sponsoring institution, we don't have a clinic ourselves, which is typically the model where you have a teaching health center at an FQHC, and then the clinical revenue supports the salaries that have to be paid and things like that. So to be clear, the reason we need business agreements with each of our clinical partners is that Healthy Rural California, as the sponsoring institution, will be paying our residents. And then those residents will be going to all these different clinical facilities and basically providing care to those patients for free. Now, we will be asking for some financial support from each of our clinical partners, so it's not exactly going to be free. But again, there's no billing that happens for the residents. There is time that the VA will pay, but again, that's a stipend based on the rotations that the residents will be at the VA. They have a different bucket of money, and that's why we'll have that agreement in place. But again, teaching health center funding is the bulk of our funding that comes to Healthy Rural California, and then we pay the residents' salary, their benefits. We help them find housing. We may have some money to do moving costs between Sacramento and Chico. We're still finalizing all of that. We have to pay the program director for their time leading the program. We have to pay for staff. The program coordinator is a required position, and so we need to pay the program coordinator, and that's all through Healthy Rural California. Again, this is really at, not cost of what it takes to run the residency program. This is Healthy Rural California, and we are supplying these psychiatrists to work in these clinical facilities. And then those clinical facilities can charge for reimbursements from whatever source they pay their psychiatrists. And that is based on the preceptor, and then the preceptor's time plus the resident's time. So there's additional revenue that is potential for our clinical partners, not for us, right? Because we're not the clinic at Healthy Rural California. So I am recording this because a lot of people in Butte County, the GME naive county, the model is what the majority of other residency programs are in the country in their brains, and we are different. And so we're going to need in September and October business agreements, program letters of agreements with all of our clinical partners. But in thinking through, in addition to that, we're really considering establishing a clinic through Healthy Rural California that could provide even more psychiatry care, possibly beyond that, sort of mental health support for the community. And that is because we have to be financially viable. And the teaching health center funding from the federal government is just not quite enough. And it is more normal to have a clinical operation that helps support the residency program. So for family medicine, it's a very different structure. Now, it's a different payment methodology. We are still Healthy Rural California as the sponsoring institution. We have submitted our accreditation application to ACGME in July for family medicine. We hope to hear, we have many steps that still have to happen, like a site visit and other things that would have to happen in the fall. And then hopefully we would hear about accreditation in the spring 2024. But that model is CMS reimbursements to our primary hospital partner, which is Enloe Medical Center. None of that, those agreements are in place. We're still vetting all of the information, but just so that you all know, CMS reimbursement rates are greater to Enloe, and then that helps fund Healthy Rural California to then pay the residents, pay their malpractice insurance as learners, pay their salaries, benefits, and pay the staff salaries as well to support it. And so, you know, even though it's different, I hope that people can really take the time to understand. I am more than happy to answer questions. I get it, it's different. It's not the norm, but it is a legitimate model. It is what the community chose in 2020. And thank God we've been down this path, because if any one of the entities today in 2023 started down the path of becoming a sponsoring institution and establishing their own specialty, you know, you're still looking at 2 to 3, 4, maybe years down the line before you're actually starting to bring in medical students and then the residents. So medical students is also something I really need to touch on. It's important for our clinical partners, especially for psychiatry, since it's been accredited, to take medical students. It's all part of the recruitment process. And in a way, they're not medical student interns. They are auditioning. They are wanting to come to the facilities that will be their residency program, right? If they're going to commit to Healthy Rural California psychiatry residency for 4 years and be a part of our curriculum and be with us, they want to know who the faculty are. They want to know who the clinical partners are. They want to be there. They want to meet you. And, you know, I get it. It's like, what, you want to send medical students to us? That's crazy. But it is actually the best way to recruit. And then it's even more of the pathway through the residency program to then recruit them as psychiatrists and family medicine docs to your facility. And if you're not doing that, then your other partners are going to get those psychiatrists. So we're really pleased to be working with the majority of our clinical partners for psychiatry, and they're just giving such great experiences for the students. It's basically promoting the residency program in hopes that they will apply and then match with us, Healthy Rural California psychiatry residency. But the long game is what everyone should be keeping in mind, which is recruiting them to your particular facility at the end of their residency. And those, you know, you might think, well, we have 4 years to figure it out. Guess what? Each cohort, each year, we're going to have all of these medical students coming to the area and getting to know our clinical partners. And if you're not jumping into that right now, you're punting it again down the line further and further of recruiting them. That is new information to me. I did not know how important the medical student rotations were so soon. And eventually, with the residents on board in their rotations, they will be teaching the medical students, so it could be an extra heavier lift now, but I guarantee you it is what we need to be doing to recruit into the residency and ultimately to recruit those residents into your practices. We only get 4 a year for psychiatry, so you know, Northern Valley Indian Health and the VA and AMPLA Health and Sutter Yuba Behavioral Health are opening their doors to the medical students and residents. They're the ones the residents will choose to be hired by. Just how it is, right? So I think that I've covered, again, I'm always open for questions. There's been a lot of misunderstandings. There's been assumptions made. There are huge assumptions for any physician that went through their residency before the year 2013 to 2015. ACGME no longer tolerates having residents be slave labor or anything like that in hospitals and clinics. It is a learning experience. They must be treated well. And there is a lot of pathways for residents to report on the clinical facilities. And then that clinical facility will not be able to take residents in the future after that complaint. And so there's a lot of assumptions of what a residency program really is. And I encourage and beg anyone that is listening to this and your colleagues and friends to really listen to what we're telling you, which is that we have to treat our residents well. They need wellness, they need a lot of support, and they will be expecting that. It is no longer the residency programs of the year 2000 or 1995 or the 1980s. It's a whole different thing. And I will shout this from the rooftops because we need to be really aware of that. And every single physician that is signing up to be faculty needs to be aware of that. We're planning a faculty development. It's primarily for the family medicine residency. It'll be September 27th, but I encourage everyone and anyone to join. Even if you haven't signed up to be part of the family medicine or psychiatry residency, the more people know, the better, because we might be following up with another residency like internal medicine. We might expand the number of psychiatry residents and family medicine residents. You know, there's a whole bunch that could unfold in Chico. And Oroville Hospital has just become a sponsoring institution and is going down the path of establishing a psychiatry and family medicine residency. Whatever that looks like, I don't know. They're still building all of that out, but they have become accredited as a sponsoring institution. Shasta Regional Medical Center in Reading just got a cohort of 12 internal medicine residents. They got accredited in March and they got their first 12 cohort going in June. They are providing free housing. They are on their 5-year cap race. They will have 5 residency programs by the year 2030. And they're probably going to be big cohorts like this internal medicine one. So, you know, I'm really looking forward to 2030. This region will be different. The recruitment of doctors to our region will be different. And if all 3 of these hospitals and health, I include Healthy Rural California in that because we are the sponsoring institution, went down the path of fully establishing residency programs to the best of our abilities to reach our caps, by 2030, this would be about 30, possibly 50 million per year of new growth, job growth, new economic development for the region. And I don't think there's been something that big in quite a long time for Northern California. I would love to hear the last time a $30 million new job industry set foot in the North State. I'm challenging you to get in touch and tell me when that was, or what that was. And that will bring, you know, what, at least 10 new doctors to the region once they complete their residency every single year in Reading, Chico, and Oroville. That's amazing. In addition to other recruitment. So I'm going to end on that note. I have, I have to admit, I'm getting tired. I feel like I've been explaining this to people over and over again. And I'm really hopeful that this will catch and people will champion healthy rural California and commit to the business agreements. It's us as the sponsoring institution, and those will be our residents working at your facilities. So we've got to partner and we've got to work the agreements out. If there is no business agreement, we won't be able to partner with you. And that's just the truth. So thanks again. Again, ask me questions. I hope that you all stay cool. It's a little bit warm out there.